Thank you so much. My name is Deborah Ekusai Sevata from Uganda, and together with my colleague Borel from Cameroon, we present the topic: Should universities in Africa introduce mandatory courses on genomics and bioethics for students in healthcare and life sciences? We are on the negative. As a way of introduction, genomics and bioethics are rapidly evolving fields that hold immense potential to transform healthcare and life sciences. The role of bioethics and genomics courses cannot be ignored, and there has been a growing push to integrate these subjects into academia. However, it's critical to ponder on its relevance in the African context as it raises an important ethical dilemma. Africa faces unique challenges, including human resource constraints, diverse cultural perspectives, and pressing health care priorities such as infectious diseases and maternal health. Mandating genomics and bioethics courses in universities across the continent may not only affect already limited resources, but also risk imposing frameworks that may not align with urgent needs. So this presentation undertakes a critical analysis of the rationale behind mandating genomics and bioethics courses in African universities, questioning whether such a requirement constitutes the most suitable or effective strategy. So, as our opening statement, imagine a classroom in an African university filled with bright, ambitious students eager to tackle the continent's most pressing healthcare challenges like malaria, HIV and AIDS, maternal health, and Ebola, which is currently affecting Uganda. Consider a scenario in which students are mandated to enroll in courses focusing on genomics and bioethics. Although these subjects hold considerable global significance, they may not adequately address the pressing health needs of the communities in which these students reside or resonate with their cultural context. So our constructive arguments um, Our constructive arguments are misalignment with immediate healthcare priorities. The argument is Africa faces urgent healthcare challenges such as high rates of infectious diseases, such as malaria, HIV, tuberculosis, Ebola, maternal and child mortality, and a lack of access to basic healthcare services. These issues take precedence over the theoretical understanding of genomics and bioethics. There is the issue of resource and infrastructure constraints. And the argument is many African universities lack the infrastructure, funding, and trained faculty required to deliver high quality and bioethics education. The absence of robust research programs in genomics and bioethics may hinder the ability of universities to provide students with practical experiences and exposure to cross-cutting developments. So there is lack of standardized ethical and regulatory frameworks. So an example is while the Belmont Report and the Declaration of Helsinki guide bioethics in the Western context, many African countries are still developing ethical guidelines, making it difficult to design relevant curricula. There is the risk of brain drain. And the argument is training students in advanced fields like genomics without creating local opportunities could lead to a brain drain where graduates leave Africa to pursue careers abroad. So there is the high costs of implementation. The argument is this requires significant financial investments in faculty training, lab equipment, and curriculum development. The example is many African universities are already underfunded. Without proper infrastructure and resources, students may only develop a superficial understanding of genomics and bioethics, which could lead to ethical risks in their future practice. The risk of widening educational inequalities and mandating these courses could worsen the existing disparities between the well-funded universities in urban areas and the underfunded institutions in rural or marginalized regions. There is a danger of one-size-fits-all policies, and the example is a university in Nigeria with a strong focus on public health may not require genomics courses and bioethics as well. As urgently as a research-focused institution in South Africa, a mandatory curriculum may inadvertently marginalize local perspectives, undermining the potential for meaningful dialogue and understanding. The limited skill sets and support among the faculty. The establishment of genomics and bioethics courses requires a commitment to ongoing faculty development and research support. However, without a solid foundation in these areas, the quality of education may suffer. So, what's our rebuttal? One is strengthening public health through genomics. And the rebuttal one indicates that there could be misalignments with immediate healthcare priorities in Africa. The second is enhancing local capacity for medical genetic and research. And here we indicate that this could be attributed to the resource and infrastructure constraints in Africa. The third is ensuring ethical conduct in genetic research, and this could be attributed to the lack of standardized ethical and regulatory frameworks in Africa. And the fourth is strengthening pandemic preparedness and genomic surveillance, and this could be attributed to the high costs of implementation of genomics and bioethics courses. The fifth rebuttal is driving scientific innovation and biotechnology development, and this is attributed to the risk of brain drain. So our closing statement is while genomics and bioethics courses are important fields with potential benefits for healthcare, making these courses mandatory in African universities may not be the most effective approach at this time. Africa faces immediate healthcare challenges that require urgent attention and resources. Instead of mandates, we should prioritize offering these subjects as electives or integrating them into the existing curricula, allowing for more flexible, context-sensitive education that aligns with the local needs. And by doing so, we empower students while ensuring that our healthcare systems can address the pressing issues effectively. These are our references. Thank you so much. Thank you for listening.